Hey guys, welcome to tonight's live stream. I'm so glad you're here. I'm Dr. Tammy. I'm a medical doctor and I am all things functional medicine and menopause, perimenopause, and hormones. And tonight we are talking about thyroid, which is a huge part of my practice. And I think one of the reasons why thyroid is such a huge part of my practice is because so many people have problems with their thyroid. So I'm going to talk about several things tonight. And one of them is, what is thyroid? And I think that this is something that you might not have ever heard before. And the reason for that is traditional medicine treats thyroid disease much differently than people who are looking for the underlying cause of disease, right? And so in commercial medicine, if you go to your doctor, they are going to a commercial doctor, like I call them that. I'm still a medical doctor, but I've gotten outside the box. But if you go to somebody who is going to spend 6 minutes with you with their hand on the door, and all they do is have time to write a prescription for you, you're going to get a much different outcome in how it is managed. And the reason I say that is because I always say a headache is not an aspirin deficiency. There's a reason, there's something that's causing your headache. And so we have to get to the underlying cause, or a commercial medicine doctor will just put you on thyroid medication and you'll be on that the rest of your life. And they will actually tell you, comment in the comments if you've heard this before, you'll probably be on this the rest of your life. And they don't ever stop to tell you what's going on with your thyroid. So a few things I'm going to share with you tonight is how the thyroid works. And once you understand how the thyroid works, you will also understand the bigger picture and how it can be treated. And every day in my practice, I get people off thyroid medication. And that is really my goal. Now, let me just say, do not stop your thyroid medication, and always, let your doctor know if you're doing anything, any natural supplements or anything like that. And you will also see conflicting information on the internet. And trust me, all the time I am looking because I want to see what other people are saying. And so you'll probably get some comments in tonight from people who are saying, that's not true. That's not true. Yes, hysterectomy. So thank you for mentioning that. We absolutely have more thyroid disease after hysterectomy. So my little teaser video today to watch this was mostly because I'm immersed in menopause. I'm much more hormone expert working with hormones than hypo or hyper. Yes, both. We're going to talk about all that, I promise, hypo and hyper. But more menopause than anything. And so I see almost 90% or more, if I had to guess, 95% or more of my women in menopause, or I always say, I didn't want to say menopause. Let me back up just a little bit. Menopause, by definition, is just a year without periods. It has nothing to do with the ovarian failure that follows not having periods for a year, because your ovaries literally die. I mean, that's a very strong term, but they do. They literally die. They're non-functioning. If you do an ultrasound 5 years after a woman has gone through ovarian failure after her last period for a year, the radiology report will actually read ovaries not detected. And that's not because they were surgically removed. That's because they literally die. So we are dealing with ovarian failure and what I call ovarian hormone depletion syndrome. So that is my mission, and I always have to get that out of the way. And if you've watched my other videos, I explain exactly what that means and what that does. But women are miserable, and just like, here's my analogy, and this is perfect tonight because we're talking about thyroid. But just like if you had your thyroid removed, you would not be denied thyroid hormones, right? But we have our ovaries removed with surgery, or our ovaries literally die after we run out of eggs and we are in our 50s and we don't have functioning ovaries anymore. So that's what we are dealing with, is why wouldn't doctors give us ovarian hormones? So I just want to kind of preempt that a little bit, that I'm always talking in some relative way about female hormones and ovarian hormones. So that's kind of kind of where I go with all this, right? But I have to explain a few things about what thyroid is, how it works, and how it's treated, and how you can treat it differently and get off medications if you're on them. Okay, so let's jump right into it. So this is my cute little drawing of a person. And this is in the head, there's a little gland called the pituitary gland. And the pituitary gland is an endocrine gland, and endocrine means hormones. So your ovaries are endocrine glands, your thyroid is an endocrine gland, your adrenals are the endocrine gland, so they make hormones. The pituitary in your head is an endocrine gland. Okay, so when you look at thyroid labs, which is what doctors check to see if what's going on with your thyroid, they will check a hormone called TSH. I'll explain that in just a minute. And this is your thyroid gland that is in the neck. Oh, and if you guys are liking this content, please share it. We're early in the game tonight. So if you know somebody who has thyroid disease or menopausal and struggling with thyroid, if you could share this to them, I think this would be really helpful. I do always try to put the replays back in, and sometimes I don't get them all back in. So this might be a one and done kind of thing. But yeah, so if you know someone you want to share this with, if you would share. And oh, and my moderator says, if you would tap the screen, like just keep tapping it like that, it'll send hearts. And so that tells me that the content's good. And it also invites other people in because the algorithm says that this cool stuff. Okay, without further ado, this is the thyroid gland in the neck. And the thyroid gland is actually making a hormone called T4, and that gets converted to a hormone called T3. Okay, I'm going to ask you guys in the comments to put what your favorite race car is. I know that sounds crazy, but if you guys would comment what your favorite race car is, because I'm going to use that in just a minute as I'm kind of explaining this. Okay, so this stands for thyroid stimulating hormone. Oh, hi, Constantina. Hello, honey. So this stands for thyroid stimulating hormone. Aston Martin. Okay, thank you. Oh, that almost looks like that's what your profile picture is. Lamborghini. Oh, this is going to be hard to decide. Okay. My son loves Aston Martins and Lamborghinis, so I'm kind of torn. A Stinger. Oh my gosh. Okay. Give me some more. I don't know. Okay. If I get two of the same one, that's the one I'm going to go with. So you guys keep commenting. Okay. So this is the thyroid stimulating hormone, and the S stands for Porsche. Okay, got it. Porsche stands for stimulating. So it is going to tell the thyroid what to do. And we call this a feedback loop. And there are many feedback loops with the brain. Maserati. Oh, my TSH was 1.88. Okay. So I'm going to talk about what actual levels are here in just a minute. So I'm not sure who FNTS 3131 is, but if you'll bring that back around, I'll kind of plug that in a minute. Okay. Somebody give me, if I see one more of the same race car, fast car, supercar, I think that's what my son calls it. If I get two of the same one, I'm going to go with that. Corvette. Man, y'all are giving me all different ones. Okay, a Lamborghini. I got two. Okay, so we're going to do Lamborghini. Okay, so this tells the brain tells the thyroid what to do. And the pituitary gland also makes hormones that tell the ovaries what to do, and also makes hormones that tell the adrenals what to do. And so this is just one of the many feedback pathways. Okay, so T4 is actually called thyroxine. You don't have to know that, but T4 is the inactive form of thyroid. T3 is the active form. And this is the only one we really care about. So this is why I said we had a Lamborghini. So this is like a Lamborghini. Excuse my drawing here, but here's a Lamborghini, right? Okay, so T3 is active like a Lamborghini. Okay, the T4 is like a bicycle. So if a doctor is only checking a TSH Or once they put you on medicine, then you might be able to convince them to check a T4. They very rarely ever check a T3. So you're kind of hearing the tone of this, that it's very important to know what all the parameters are. And before I went to med school, I went to x-ray school. So I was actually an x-ray tech. And the reason I'm telling you that is because if a patient, let's say, broke their leg and the bone was fractured, but it wasn't fractured all the way through. If we didn't do what's called two views, so you take a front view and a side view, the radiologists would like get super mad and they would like throw stuff at you. Doctors hopefully don't do that anymore. But it's so important that you get two views of a bone because you can't always see what's on the other side, especially if it's a dense bone. So they used to always say, one view is no view. And so just like that, the thyroid, one thyroid test is no test. It means absolutely nothing. And if a doctor is only checking a TSH, that is not even a thyroid hormone. That is a pituitary hormone. So it's like, what the heck are you doing? Because you finally get them. Now, this is funny. You ask a doctor to check your hormones and think about ovarian hormones because you're tired, right? Which is one of the main things in menopause. And you ask them to check your hormones. What they check is a TSH. Nothing else usually. I mean, unless it's, a functional medicine doctor or somebody who's really progressive, I would say, and whole body thinking. But you have to ask for a full panel, which is really sad that you have to advocate for yourself because that's just stupid that you ask for your thyroid to be checked and they only check a pituitary hormone, right? Okay, so when I say one view is no view, you need a TSH, a T3, and a T4 at minimum because you want to know what your race cars are doing, right? You don't want to be riding around a bicycle. So I'm going to tell you whether it's important with medication here in just a minute. And hopefully you don't have to stay on medication forever. But this is very fascinating because when you think about T4 to converting to T3, this feedback loop is very important. So you have to have at least this. And I always say that you have to have 5 different tests to know if your thyroid is functioning or not, because you can get a false negative about thyroid disease if they only check a TSH, because it's not telling you if you're making, what do we say, Lamborghinis. It's not telling you if you're making Lamborghinis. So it's just really super important to know, do I have Lamborghinis or am I riding on a bicycle? And anybody who's ever had thyroid disease, hypothyroid, we need to talk about that too in just a minute. But anyone who's ever had a low functioning thyroid will tell you it's like trying to go to the store 10 miles away on a bicycle. Okay, armor. Okay, so we're going to talk about that, Elaine. So this is cool. Okay, so there is something called hyperthyroid where your thyroid is overactive. And I'm going to focus on underactive because that's the most common thing that I see with perimenopause and menopause. So hyper means everything is sped up. These people will be anxious. They'll be heart palpitations or heart racing. They'll have diarrhea. They'll have everything, your whole metabolism sped up. And it sounds like a nice thing, right? Because you're like, oh, my metabolism sped up, until you start having reflux and headaches and your heart's racing. And it's the same principle as taking Premarin in old days. Yes, you're absolutely right, Elaine. Okay, so I'm going to take hyperthyroid off right now. And then I'm going to leave hypothyroidism. We're going to talk about the different types. And I'm going to leave thyroiditis on there because thyroiditis is quite fascinating. And I think of it like its own different entity, basically. Okay, so what Elaine is saying is that Premarin was a synthetic form of estrogen, and Armour thyroid is a natural form of thyroid. So kind of what we call bioidentical. There's bioidentical thyroid and there's synthetic thyroid. So I'm going to talk about that too. Okay, so this T4 is called T4, and there won't be a quiz on this, I promise. You don't have to know this, but it's called T4 because it has 4 iodine molecules on it. So that's not really all that important, but if we do some organic chemistry and we put 4 iodine molecules on here, T3 has, guess how many? You guys want to put it in the comments? T3 has 3 iodine molecules. And this one's called triiodothyronine, and you don't need to know that either. But what happens is your body literally pulls off 1 iodine molecule and leaves it with 3 to make T3 or Lamborghinis. So why is that important? Because you've probably heard about iodine and thyroid, and the question is, should I take iodine or not, right? So we're going to talk about that. So you absolutely need iodine. And you need to be able to pull that iodine molecule off, okay? So there is an enzyme, and an enzyme is sort of like just a converter. So think of this like a factory. So this is like the foreman of the factory or the boss, and this is the products being made in the factory, okay? So whatever the factory is, let's say this is bread being made in this factory, and let's say that this is like yeast. So when you put the yeast in the bread and it rises and it gets activated, that's when you have the T3, okay? So there's an enzyme here called TPO, thyroid peroxidase. TPO. And what you check for is thyroid peroxidase antibodies in autoimmune. So I know I'm skipping around a little bit. I promise I'm going to pull this all back together in a pretty little bow. Okay, so when I say you need more than one test, you need at least a TSH, at least a T4, at least a T3, and a TPO. And there's a whole bunch more. We can talk about those. But if your TPO isn't working, you're not going to convert into your active form, and you're going to be riding a bicycle around all the time. And at the very least, a bicycle is nice. I have an e-bike, so even an e-bike is nice, but you're never going to be able to get everything you need to get done in the day if you have to go run errands to the bank and you need to run to the school or, wherever that is. You're not going to get all that done on even an e-bike, right? You don't necessarily have to have a Lamborghini either, but at least you want like a minivan or something like that. You want to at least be in the middle, right? Okay, so if you have to have iodine molecules to convert to this with 3 iodine molecules on it, then if you are iodine deficient, can you see that that could be a problem? And so some people will say, be careful getting too much iodine. And that is true, because if you get too much iodine and you have a conversion or a TPO problem, or you don't have, if we use the analogy of bread, then you could have problems with your conversion. And then you're just going to back up in T4, and then you're going to back up your iodine. I crave salt. Okay, so we'll talk about salt and the different kinds of salt. But if you crave salt, oftentimes that's because you need the minerals in there. And it's not really, because white table salt is sodium chloride. And it's just basically sodium, right? So the pink salts or the Himalayan salts have sodium, potassium, magnesium, iodine. I mean, they have like all the things, which is why it also helps blood pressure if you do the pink salt. And sometimes people crave salt because they have adrenal issues. So I have to back up just a little bit and say that all of your body is one big system. And so we really can't just talk about the thyroid. We have to talk about the ovaries or the lack of ovaries when we talk about the thyroid, because we're going to talk about estrogen in just a minute. Yeah, Celtic salt, those are, it's like some of those salts are from different places. And so as long as they are mined and they're the kind of the whole salts, that's why the pink has more minerals in it. But there's a lot more to it. So I won't break that down too much, but I'll tell you a story. I think this will make it really relevant for salt too. So about 30 years ago or so, when our food supply started changing, we had a problem with kids getting goiters or large thyroids. And they started having mental retardation and brain damage and deformities. And so they realized that it was an iodine deficiency. And so what they started doing was putting iodine in table salt, because pink salt or the Himalayans or the Celtic salts, they already have iodine in them. But Morton salt came around, right? And they started just like selling this white sodium chloride because it was easier to produce than to mine it from, the sea or where, the mountains by the sea or wherever they get it from. I don't know. I don't even know that. So I can't speak to that. But so they started putting iodine in the table salt, which seems really, really strange because then they also started fluoridating the water. And on the element chart, if you're familiar in science with the element charts, like remember all the minerals and stuff, iodine is displaced by symptoms of anxiety. Yes, absolutely. A lot of thyroid, low thyroid or high thyroid can be anxiety. Iodine is displaced by bromide, which is in the bread now because they've totally messed up the bread supply. I mean, it's like it's nothing but gluten and sugar. I mean, it's nuts. Even bleached with chlorine now. So it's just, it's just nuts what they've done to white bread. It's creepy. Um, but also fluoride displaces iodine. And I remember I had a dentist tell me that the reason kids don't get cavities anymore is because all the fluoride and the fluoride they put in the water. And that is one of the biggest lies that we were ever told because kids still get cavities. What causes cavities is all the freaking sugar in our diets and the sodas, drinking Coke all the time or Dr. Pepper or whatever. That sugar just sits on your teeth. So it is not the fluoride that is, the problem putting that in. Kids still get cavities. And I'm embarrassed to say that my son's had more cavities than I want to claim. So, yeah. So, I mean, it's a thing. I mean, you guys can tell me if you think differently, if you don't think kids are getting a lot of cavities these days. But I think that if we are going to argue that fluoride's protective, and this isn't a fluoride discussion, I promise, that we really have to look at the rates of cavities because I bet that you could probably see that it's really not what they want us to think. Okay, so let's talk because a few people threw their TSH levels in there. So one person said their TSH was 1 point something. And a normal TSH is usually anywhere from 0.4 to 4. And this is interesting because you know me, I love to draw graphs. So if I drew a graph of what's normal, and they call it a bell curve, and we were to put 0 to 4 on here, 0.4 to 4, and in the middle was like what normal was, and then we put this graph on here of what normal is, and most people will fall in the middle of this looks like a bell curve. And so some people will be 0 point blah blah blah, and some people will be like 1, 2, or 3, but we call this normal. So really, what is normal? And if you're not looking at the TSH in context with the other thyroid hormones or with estrogen, the waters are really, really muddied. Now, here's the deal. Over the years, they have actually lowered what they call normal. So now this is where it gets tricky. And I have patients who've been my patients for many, many years who still don't really get this. And they'll still look at, okay, Mona Lisa, I can't talk about that. I'll get in trouble. I got cut from a video one night. So I agree with you, but I can't talk about that. So yeah, so I got to be careful with some of this stuff, right? Okay, so yeah, so the range has changed definitely of what we call normal. And so since so many people, you're fine. I'm sorry too. Oh my gosh. Yeah, trust. Sorry. I'm on the fringe of everything I say. I mean, like target on my back kind of stuff. Or this is like heresy stuff, So I like. Okay. Anyway, so what we call normal has changed over the years. It's kind of like cholesterol levels. It used to be like 350 was a normal cholesterol, and then they kept moving it down, and they keep moving cholesterol numbers down so they can throw you on a statin. I mean, that's nuts. And cholesterol and thyroid are related. I'm going to tell you that connection. So high cholesterol, you have thyroid dysfunction, and that needs to be addressed. So it's like this whole little puzzle that has to go together, right? So in the analogy of a factory, the gland up here in the pituitary that makes this TSH tells your thyroid what to do. So you could think of it like a factory where these conversions are happening, or you're making bread and you're putting yeast in the bread. And I just said bread's bad, right? But so T3, the active form, has to have this yeast or this TPO to make that. So what happens is the thyroid is talking to this gland up here and it's telling to stimulate. So this will always, if things are functioning normally, this will always be high when this is low. And so people will see a high TSH and think, I need less, or they'll see a low TSH and think, I need more thyroid hormone. So it's just the opposite. I'm going to say that again. It's just the opposite. Okay, so if you don't ever remember which one is high or which one's low, always remember that the brain is opposite the thyroid because it's telling it to make more. And it's just like your kids when you tell them to clean their room. What happens if they don't clean their room? You go to them again and you say, please clean your room. And then if they still don't clean their room, what do? You get a little louder. And then you say, said, please clean your room. And then if they still haven't cleaned their room and it's like the next day and you're frustrated and the rest of the house is a mess and all these, it's like the phone's ringing and the dog pooped on the carpet and you're screaming, I said, clean your room. It's like you're just like freaking out, right? That's what the pituitary gland does. So when the thyroid's not functioning, the mom up there is saying, clean your freaking room. We need some thyroid hormone because we are dying. We can barely move. So just remember that that's always going to be different. So we want this TSH to be as low as possible. Now, if you give somebody too much thyroid hormone, you can call what we say suppressed TSH or suppressed thyroid. So that can be a problem too, because that can stimulate racing heart. It can stimulate hyperthyroidism or too much thyroid. So we marked hyper off the list because we're talking about hypo tonight. So this will be opposite, right? So the TSH, when that person said it was 1.0, this is pretty low. We like that. And somebody that had a TSH of 4.5, that's a pretty sick thyroid. And your thyroid is, the kids aren't cleaning their room. And so the louder this is or the higher this is, the more of a problem that you have. Okay, so I want to talk about the 6 types of hypothyroid because this becomes very relevant right now. And the first type, and if you don't know the 6 types of thyroid, then if your doctor just checks a TSH and puts you on some hormone, thyroid hormone, that's really scary because it's like, don't you want to know what caused it? Because is it the canary in the coal mine? Is there something else going on that you need to know about? And I find in my practice with autoimmune thyroid, meaning your body's fighting itself, that autoimmune is not just in one place. It brings 3 friends with it. So autoimmune, if it's thyroid, you'll have autoimmune diabetes can be autoimmune. You can have autoimmune arthritis or skin, scleroderma, Sjogren's, lupus. There's so many things that come with it. So you very rarely ever get just one autoimmune condition. Yeah, autoimmune moves around because autoimmune all starts in the gut where your immune system starts. Okay. So I do want to talk about the medicine real quick before we move on. Autoimmune asthma. Yeah. Okay. So I do want to talk about this just a little bit. So if someone puts you on synthetic T4, you are only going to get T4. So the other names for that are levothyroxine and Synthroid. So there is another form called Cytomel, which is T3, and you could take kinds but most doctors will just put you on T4 or levothyroxine or Synthroid, and you need T3 because that's just a bicycle. The doctors are just giving you a bicycle, right? So you want your Lamborghini or your Aston or your Maserati, whatever you want to call that. And if you're not converting, which relates to the 6 types of thyroid, then you are just going to not convert here, and they might be giving you a lot of T4, and then you don't have T3, right? So we actually have a commercial form of T3 called Cytomel. But the cool thing is if you take something, so this is Synthroid. This is getting really messy, I'm sorry. And T3 is called Cytomel. If you don't want to take two different pills, okay, Kim says I take both. Liothyronine, yes, that's Cytomel or T3. You can take something called Armour thyroid, which is desiccated pig thyroid. It's just chopped up pig. Or you can take MP thyroid, and I won't go through how these are all different, but they kind of are. Or you can take a compounded thyroid, T3, and compounding pharmacies will make that special for you. And so this covers everything. Now, if you've had your thyroid removed from cancer, or because someone told you that your thyroid was a spare part and you had hyperthyroid, so let's just take it out, which is terrifying, absolutely terrifying. I hope that hasn't happened to any of you. What you can do is take Armour thyroid or MP, and it'll give you everything that you need. Plus, there are other thyroid hormones called T1, T2, and calcitonin. And calcitonin is very important for putting calcium in your bones. So it's nuts how all connected this is. Oh, I'm sorry, Brenda. Ugh, I'm mad for you. Oh, it just makes me so mad. Okay. And the problem is, if hyperthyroid is autoimmune, and most of it is like Graves' disease, you fix the autoimmune problem and you don't take the thyroid out. That is the dumbest thing I've ever heard. And there's lots of ways to fix autoimmune. And so that's beyond the scope. I did the gut talk yesterday. So, and I did post that live replay, so you might want to go back and watch that. So, okay. So that's how you can get the most complete thyroid. And doctors don't like using Armour thyroid because they can't track the TSH, and they say they can't track T4 and T3, but they use T4 and T3 anyway. So that's just such a stupid thing that they say, right? So anyway, I always use those. And it's okay. This is crazy. I have to tell you this story real quick. I love this. I love these like history. I love the history of stuff. I'm just a nerd with loving the history. Because once you understand history, you can kind of realize what's happened and how it got off kilter, right? Hashimoto's. Okay, we're going to talk about Hashimoto's too. But the Synthroid, if you're not on a Cytomel and a T3, then I would recommend doing a combo. And then what about REI for Graves? Graves is a little beyond the scope tonight just because that's hyperthyroid. So I'm not going to get into that, but I promise soon I will do a hyperthyroid talk. But it's a very different mechanism. So let's hold off on that because there's lots of medications and stuff that you can take to slow the thyroid and to help with symptoms. But the problem is that that's not fixing it, right? And then people have issues with T3 is expensive. Normal T3, T4 on selenium. Yes. Okay. We're going to talk about supplements too. And statins. Yeah, I definitely want to do that. Okay. So let's finish this up. So, the history. I was going to tell you the history. So back in the history of when people first started having thyroid issues, they came about from nutrition deficiencies. And in Asia, they had enough iodine because of seaweed and kelp. But over in England and some of the other countries, they didn't get as iodine. And so they started having issues with their thyroids and hypofunctioning. And so they literally would take a pig and cut its thyroid out, cut a slit in people's chest, and literally put that little bit of thyroid gland in their chest, and they found that they got well. So and children that had mental retardation and things because they had low thyroid, that's how they treated it. So that's just crazy. So it's fascinating. Okay, so if you want the more complete form, and now we can take it as a pill, which is much better than a slit in your chest and putting thyroid glands in there, right? Oh, thank you, Amanda. I think I just got some kind of little love note or something. Oh, and if you guys like this, please share it with somebody because I have about 30 minutes still that I'm talking and there's still some good meat to get to. And if you tap the little screen and give some love, some little hearts, it sends the algorithm out so that more people who need to hear this information can come in and hang out with us. Okay. So I'm going to clean this up because this is super, super messy right now. Well, no, I think I'll leave the important information here. So let's talk about the 6 types of low thyroid. Okay. So we have brain. So I'm going to go back up here because if your pituitary gland isn't working right, then your thyroid's not going to work right. Right. So we need to look at TSH, and there's other ways to check TSH because you can check an FSH, an LH, and so a prolactin, and so you can check other hormones. So if anybody has a low TSH, wouldn't that be a reason to think, well, maybe if they've got a low FSH, that the pituitary gland isn't working? And if you find that out, wouldn't that be important for knowing about your because if the FSH isn't working, you might not be able to get pregnant. That's your follicle stimulating hormone. And then your ovaries might not be working, right? Or if you have a tumor in your pituitary. So you could be, uh, okay, I just got for saying something I wasn't supposed to say, and I'm not even sure what that was. I'm like totally flying by the seat of my pants with some of this stuff, but it's the truth. Sometimes the truth is not like very welcome. So, okay, I'll be really careful because I don't want this live to end. So, let me think about this. Okay, so yeah, so it could be a brain problem. So we need to check that out, right? Okay, now it could be a thyroid conversion problem. So your T4, this is so messy now, I'm sorry. You might have a problem converting from the bicycles to the Lamborghinis. And if this happens, and this, remember I said this TPO here, if that's not functioning, one of the main reasons for that, this isn't converting, is leaky gut. And I mentioned a little bit last night when we were talking about the gut that there is a protein called zonulin that gets triggered from the gut that looks like TPO. So your body will start attacking thyroid peroxidase antibody. So the solution for that would be to heal the leaky gut. So, okay. It could be carrier protein. So this is called TBG. And the interesting thing about TBG, if you're taking notes, this is a really important one. If you've had thyroid disease for a long time, TBG can work like a tumor marker, like a PSA works for the prostate. Now, false negative or positive, right? But it's really important to have a baseline thyroid binding globulin because if it goes way up, that could tell you that you have thyroid cancer. And that's a reason to get an ultrasound. And I think everybody who has any kind of nodules, you should always make sure that the doctor feels your neck because I've had so many patients come to me with these huge goiters and tumors, and nobody ever even looked at that. Yes, that's why TPO goes up in Hashimoto's because it is an autoimmune thing and the TPO will go up. What the TPO, it's not actually TPO that goes up, it's the antibodies against the TPO. Antibodies are white blood cells that attack viruses and bacteria normally. Antibodies, when they start attacking your thyroid, that's not a good thing. So it's TPO antibodies actually. So goiters are actually overworked thyroid glands, and a lot of times goiters can be from iodine deficiency, which is why the little kids were getting uh, they were getting dwarfism, they were getting mental retardation, and then that's why they put the iodine in the salt to try to prevent that. But there's a difference between optimal and just enough to keep you from having babies with malformations and and processing disorders and things like that. So I always say it's very different. Like a normal vitamin D is 30 to 100. But if you're at 31, that is not optimal. I mean, you need at least 80 to 100 on your vitamin D. So what's optimal in your iodine, right? Okay. So the carrier protein Ubers or taxis. And so the TBG are carrier proteins. So it's looking for antibodies against your taxi. So it's like people who are maybe angry at the Uber system or something like that, so it's attacking your ability to get your thyroid hormone into the cells. Nutritional deficiencies. Okay, I promised you I would talk about that. So we talked a lot about iodine, which could be a nutritional deficiency. Selenium is one of the elements that is very important for getting iodine into the cell. And you can actually test levels of selenium and zinc. And a lot of doctors don't do that. Most people are deficient. So there are different supplements you can get that have a balanced amount, because zinc and selenium have to be balanced. So if you take too much zinc, it can displace the copper. And iodine is interesting because bromide displaces iodine and fluoride displaces iodine. Mercury, heavy metals. So sometimes if someone is having thyroid issues for a long time, we'll do heavy metal testing because that can affect it too, because it's displacing the iodine and then the thyroid's not working. So that's interesting. So nutritional deficiencies for sure. And thyroid resistance is when you can check something called a reverse T3. That's another level you can do. And the T3 doesn't convert back and forth to T4. So we can see that zinc causes nausea for me. What can I do to relax my gut? Yeah, it's all about the balance. So you might be getting too much zinc. I would recommend you get your zinc levels checked. And then I'd make sure that you're using, like, some of the companies have a blend. They call it like a thyroid supplement kind of thing. And how do we test and where? So usually if you can find a functional medicine doctor, of course I do all that, but if you need someone near our program, Hormone Bliss, our experts can recommend testing if that's something that you want to do. And we have access to the lab that can do we really just focus on menopause and perimenopause and estrogen dominance, but our experts are wonderful. If you go to the link in bio, I just changed the link in bio today. So exciting, because I didn't know there was this thing called Linktree. And if you go to the link in my bio, it will take you to a tree. And my team helped me put all my freebies. No, I mean, like, I think there's 7 on there. Many, but I think there's 7 on there. So if you just want a bunch of free downloads and information, you can go there and download everything. And there's also a link so that you can go and take a quiz, which will tell you, is your primary thing menopause or thyroid? And so it's just a free quiz. It's just questions that it asks you. And there's also information to buy the test kit so you can check your estrogen, progesterone, and testosterone. Because in menopause, I'm gonna share that with you real quick here. And I know we only have about 15 minutes, but so if you want to do the test kit, it looks like this. It's on our site, hormonebliss.com. But if you go to that link tree, it'll lead you to order the kit. And I really wanted to get people, make this really affordable for Christmas time, because I love to give presents at Christmas time. So it's usually a $300 test. And this month for Christmas, it's only $119. So if you went and got your estrogen, progesterone, and testosterone levels checked, they'd probably charge you like $600 at, one of the labs or one of the offices. So anyway, this is cool. It is a saliva test, and you just pop it in the little mailer and we get the results. And then our experts will get on the phone and give you the interpretation and a plan. And so you can talk to them about getting on bioidentical hormones. And my goal is, you hear me say this all the time, before I leave this, 50% of women, because only 5% of women are on any kind of HRT or BHRT. And my goal is that menopause is just a term that means no periods. It's ovarian failure that we have to deal with, and that's affecting all of this. Yes, shipping is free. It absolutely is. And there's no tax because it is a medical kind of lab test thing, right? So they don't charge tax. So yes. Okay, so enough about that. And then we talked about thyroid resistance. So the reverse T3 is something that you can do. And I actually have, it's not in the freebies right now in the link tree in my link in bio on my main profile page. But I do have that, and I'll get somebody to load that this week, so you can go get that information, all this nerdy stuff. Okay. And then autoimmune. And so we talked about leaky gut. So your gut is your barrier to the outside world. Um, in its little layer that's kind of like a mucus layer, and then antibodies called IgA. So if your gut is upset, or that barrier is upset, or it's just like having absorption problems, that's the term they call leaky gut. I like to call it malabsorption because it sounds like not so weird as leaky gut. And that's got kind of this negative connotation too. So it just sounds better to me to say malabsorption in your gut, or if you have inflammation in your gut. Dangers to synthetic hormones. Okay, so that's a whole nother conversation. But here's what I always say: a synthetic hormone, and if we're talking hormones, because these are hormones, right? But if we're going to talk ovarian hormones, there is synthetic and there is organic or clinical. Stop periods that last month. Okay. I'll answer that in just a second. But I do want to say the difference between a synthetic estrogen is the difference between a strawberry and a strawberry. Your body knows what to do with a strawberry. Not know what to do with the strawberry candy. It's a high fructose corn syrup rock, and it can give you diabetes, right? So when you say, are they, yes, synthetic are dangerous because your body doesn't know what to do with it. And if your body doesn't know what to do with it, and it's spitting off metabolites that could be problematic, yeah, then that sets you up for ovarian, breast, uterine cancers, all sorts of things. So everything we do is organic. And trust me, I have researched this. I've been doing this almost 25 years. I am such a nerdy researcher. It's like, I know this stuff. I mean, I promise you, I did a whole internship for a whole year just on um, a thyroid research project. And so black bears of all things. And no, people always ask me, did you actually go out and get the blood draws from the thyroid, the blood draws for the thyroid from the black bears? They were hibernating. And I'm like, no, we need people to do that. I would, yeah. And did you know they don't actually, like, they're not asleep or you can't, like, they are just um, they're barely asleep. They're just in metabolic shutdown. So it's like if you get woke up from a nap and you're kind of groggy, that's really what they're in. I mean, I guess there are some animals that truly hibernate, but to just do that heavy, like they've ate a bunch of calories and they're down for a winter's nap. So, but no, I did not. But I did study thyroid and brown fat, which is a whole nother story. But anyway, the connections between. So I know how the thyroid works, and it's just fascinating to me. So yeah, all this is connected. Long periods that last months. In a nutshell, identical progesterone to balance out your estrogen, because long periods that last months are estrogen dominance, which means too much estrogen, not enough progesterone. So organic, natural, bioidentical progesterone is the fix for that. And usually we do cycle progesterone. So our experts help you with that. It starts with kids. So we know what your levels are, and then we can tell you what to do about that. But that's one of our specialties too. So I love perimenopause and estrogen dominance in any form. I mean, it can start 9-year-olds. I mean, it's nuts how our system is. But tried BHRT for a month for hormonal migraines, had horrible anxiety and shortness of breath. Well, I would say that you were not on the right dose, and you want somebody to work with you. Experts do, they work with you until they get it right, because everybody's different and one size does not fit all. So without knowing what they tried you on, it's very important that you get that balance. So if they did like an estrogen patch without progesterone, yeah, you're going to be like PMSing all the time. You're going to feel awful. Or if the dose of estrogen is too high and the progesterone's too low, you're going to have estrogen dominance, and that's what you have during the mid part of your menstrual cycle, and that's why you feel like crap, like you're all the time. Would an IUD work? I'm excited to try the test. There's two different kinds of IUD. Turmeric. Turmeric can help with inflammation for sure. So the two different IUDs, one excretes synthetic progesterone, which I try to avoid, and one is just copper. So if you need birth control, I say just get the copper. Now, the synthetic progesterone will stop periods, but I don't think that's really the right answer. You need to balance out those periods with natural progesterone if you can, but there are indications where I do recommend that women get the Mirena or the hormone-inducing or excreting IUDs. And I think I missed that. I just did a video today in my feed. And so this is fascinating because I had a patient not too long ago who told me that a doctor had told her to use Tums, like what you take when you have stomach upset, muscle cramps, like you get muscle cramps in your leg. And Tums are calcium carbonate. And so the calcium, there's skeletal muscle, but it relaxes the muscle. And so I did some research because I thought, well, the uterus is a muscle. So if you're having cramping and pain, there's a ton of research. So I just did a video today. The one thing you should have in your cabinet if you have heavy periods, and also those contractions are contractions in the uterus, not pregnancy contractions, but also could be very painful and cause bleeding and stuff. 41 progesterone, 215 in estradiol, and luteal phase was taking 100 milligrams progesterone and 1.53 Evamis. It sounds like, even when you have certain levels, if you don't have someone who will work with you, because what's normal for you is not normal for someone else. And when I look at someone, and it doesn't look like they have particularly estrogen regulations, I listen to them. And if they sound estrogen dominant, it can fluctuate in time for sure, but I always listen to the patient. And my experts are taught to do that as well. So that can be really important. So you do sound estrogen dominant with what you told me, though. So there's something called the Omni calculator. And how do you take turmeric? A lot of people take turmeric, just ingest it. So it just, like, as far as doing your bioidenticals, it just has to be balanced. And usually I'll use just progesterone when women are having cycles, but if they're really estrogen dominant, that can be a problem. So that's called Omni calculator. So you can go, and when you type in Omni calculator, type in Omni calculator estrogen calculator, because Omni calculator brings up stuff. And it will tell you if you're estrogen dominant. And then it also tell you all the symptoms of estrogen dominant, so you can read all about it. Okay, I know I only have less than 10 minutes, and they will kick me off if I go too far over. So I do want to talk about the importance of finding these. I talk about thyroiditis, which is multifactorial, but a lot of times what I see for thyroiditis is Lyme's disease. So if you have an inflamed thyroid, which you can tell if you have an elevated inflammatory marker called a CRP, SED-rates, or any of the what they call acute phase reactants. So there's a lot of different cells that can. Why do they kick you off? Oh. If I said why they kicked me off, I'd probably get kicked off. I love you so much. Cut sugars, milk. Yeah. So lots of things. When you talk about food, she's talking about different things that she's cut out. So yeah, so that's a whole nother thing. But thyroiditis can be set off by food sensitivities, which you can do testing for, and we can do testing for that as well. And infections. So things like shingles can set them off, Lyme's disease. So those are all things, like if you're going to do infectious disease, hepatitis can set it off. So there's lots of different infections. There's an infection called EBV, which is Epstein-Barr virus, that is related to, you've heard the term mono. So that can set it off too, which is interesting because people get tired when they get mono. And the reason they get tired is because it affects their thyroid. And it can be transitory, right? But sometimes it's not. And sometimes it can to resolve that. Okay, so the other thing I want to talk about, and this is fascinating because I just have a few minutes. Of course, I want to tie in menstrual, ovarian, perimenopause, menopause, estrogen, because this is so cool. Are you ready for this? This is so, so cool. Okay, so I'm going to put the liver in green. What's the with all of this? The liver is so important. It's not just because I'm like some quacky person out there going, oh, you got to fix the liver. This is why. Okay, so the liver is, say it's right here. And The liver, yes, it processes toxins. It does all sorts of really cool things when you take, which is one of the reasons why when you take estrogen by mouth, it goes through something called first pass metabolism. So the liver has to process it. But the liver is more of an endocrine, remember, endocrine organs make hormones, than it's more of an endocrine organ than any other of your endocrine organs. And nobody thinks of it like an endocrine organ because it's not your ovaries, it's not your thyroid, it's not your adrenals. But what it does, processes most of your T4, T3, 70 to 80% of all of that thyroid conversion does not happen in the thyroid. The thyroid makes it, but the liver converts it. So you don't got no Lamborghinis if your liver's not working right. Okay, so here's the other deal. The liver also processes estrogen. It doesn't really like to process progesterone because it's a big old molecule, but estrogen is processed through the liver. So never, never, never take estrogen in the oral form because it's going to get really confused and it makes all sorts of metabolisms. We have so many different kinds of estrogen, so that's a whole nother conversation. But that is the reason why menopause and thyroid are so connected, because some of these different types of thyroid conversion can be related to estrogen dominance, but thyroid resistance is related to menopause, which is estrogen depletion. So, like I say, almost who come in symptomatic with 100 different symptoms of things that they don't even think of as, oh, thank you, Mona Lisa. That's sweet. Beautiful info. I love it. Yes, it's cool info for sure. That come into my practice with perimenopause or menopause symptoms or estrogen dominance, almost all of them have thyroid dysfunction. And when I sit down and go through someone's labs, I go through line by line by line because I believe education is power. And I believe there's a reason that in the past, in cultures where there were slaves and stuff, they didn't want them to read. They didn't want them to understand because they can't control them. So if you understand this, you can't be misled, you can't be controlled, and you have your power. And nobody just scoot you under the rug. And people that have kind of become my little tribe here understand this, right? Because you are the people who have struggled and had challenges, and you are hungry for the truth because that system has failed you and it's not working for you. So this is everything. This is your power. Oh, yeah, it's a mess. It's a mess. Let this mess be your power, but the information is your power. So she says, I have hyperthyroidism Graves and I'm really struggling with all my hormones. Yeah, because all of them convert through here, right? Your estrogen, your thyroid. And I just want to say a quick thing because I said I would, that, can you see this side here? I think that's out of view. Let me just do this really quick because I love, love, love for people to understand this. Let's get rid of some of that mess too. Yeah. How my brain is. It's all messy like that. I wonder what's going on in my brain. It's all of this all the time. Okay, so your body, it's doctor's handwriting for sure, right? And it turns it into progesterone and then turns it into estrogens. And I say estrogens because there's different kinds. And then into testosterone. And this word steroid means steroid. So these are steroid hormones. And then cortisol is over here, which is your anti-inflammatory stress hormone. And so cholesterol, almost 90%. I don't like to quote all these percentages because, it's like whatever. But most of your cholesterol is made in your liver. It's not dietary. It's not anything you ate. It's your body making it, just like your liver makes most of your sugar. Well, I mean, a lot of it's dietary because we do that to ourselves. But so your liver makes most of your cholesterol. So doing a cholesterol or a lipid panel shouldn't be a statin deficiency test. If your cholesterol is high, it means your ovaries aren't working anymore and they're trying to make more of these hormones. And there's a deficiency here. So your cholesterol is upregulated by your liver, right? And all of this is going on in your liver. Most of your thyroid's converted in your liver. So it's super, super, super important that you have good liver health. I usually drink my dandelion tea night because I was kind of rushing from work today. But so yeah, so I have to wrap this up. I love you guys so, so, so much. Yes, Mona Lisa, that is why it goes up. And they don't tell you that because they want to stick you on statins and they're terrible. And there's no studies in women that show that they actually protect you. So okay. So anyway, my last little plug, because I love you and I so want to help the world. And I want you guys to tell that there's a truth there that is not being shared with you. And I come here every night at 7 o'clock because you guys show up. And as long as you do, like even if one person showed up, I would still keep coming. Oh, thank you. Happy holidays to you. So as long as even one of you are here, I will keep showing up. I think I'm going to, after the new year, start. Oh, yay! My tribe is here. I feel like it's a party. Maybe some night I'll have my pajamas on or something, or maybe I'm even going to be here Christmas Eve. So if you guys are bored Christmas Eve, come on, we'll hang out. We'll talk about whatever you want. But I usually have a topic prepared, and this month we're doing the 25 symptoms of menopause. So thyroid was clearly one of them. So yeah, so I'm here. So I just want to remind you, if you want to get your hormone levels checked, they are my protocols that are based on these labs, and we can do lots of other testing too, and our hormone experts can help you with that. But when your ovaries have failed, or you're in perimenopause and your ovaries are failing, we can stop that madness and can help you feel better. And that is my passion, because women are suffering needlessly, begging for help, and it's gross and it's stupid and I don't understand it. So work on 24. So yeah, so it's 119 and they're going to so hang on just a second. Oh, I know I'm going. I don't want to go. Okay, hang on just a second. Okay. I'm begging for them to give me just another minute. Yeah, so 119 for the test kit, and go to hormonebliss.com or my link in bio. And there's lots of freebies in there too, as well as the free quiz and more info. So I love you all very much. Please have a wonderful night and be strong and keep the faith. And I'll see you here tomorrow at 7.